Hi friends. So I am telling today one or two mnemonics to you which might be coming in the exam. So one of them is regarding the negative sense. Okay. Negative sense RNA viruses. These all they should have a particular enzyme with them, that is RNA polymerase, to get into the positive sense. Okay. So mnemonic for this particular one, negative sense RNA viruses, is always bring. Okay. Always bring polymerase or fail replication. Okay, so this particular mnemonic can help you in the exam, in the time of fighting. This can help you to remember at least the negative sense RNA viruses. Fine. So what is in that? You remember like this. The first one, A. A is what? A is arena. Arena virus. Fine. B is what? B is bunia. Okay. P is what? P is paramyxo. And these all are families like arena viridi, bunia viridi, paramyxo viridi. Okay. And O is orthomyxoviridae. Fine. This particular one. F is phyloviridae. F is phyloviridae. O is orthomyxoviridae. And this R is rhabdoviridae. Okay. So A is arena, B is bunia, P is polymerase, O is orthomyxo, and F is phylo, and R is rhabdo. Okay. So this particular mnemonic will definitely help you to remember what? The various negative sense RNA viruses. Fine. So remember this particular one. This might come, and all of them they need what? They need RNA polymerase to change from negative to positive sense. Fine. Then if you want to remember something about the diphtheria toxins and all, I'm taking it randomly. Okay, I'm not going the like virology and all that. Important ones I'm taking up, which can help you to remember at least something. So if somebody asks you that diphtheria toxin, this particular toxin, you know it's a what? It's an exotoxin, strong exotoxin. Okay, which needs what? Iron for its action. It needs iron for its action, and that to a optimal amount, not neither less, neither more. Fine. In this, if you get confused up that what are the properties of this and all that, you can remember by this mnemonic A, B, C, D, E, F. Okay. These particular things will help you to remember the diphtheria toxin action and how many components and all that stuff. So obviously, it is having two components. One is A and one is B. B always helps in what? Binding. Fine. It always helps in what? Binding. And A does what? ADP ribosylation. That you know. Okay. It does ADP ribosylation. So this is your starting A and B. What is this C? C is this. That is for Corynebacterium diphtheria only. This particular mnemonic is for conjugated diphtheria. And what is this particular? Basically CD means conjugated diphtheria. And this EF is what? It is what ADP ribosylation. It is ADP ribosylation of elongation factor 2. Okay. That is the ADP ribosylation of what? Elongation factor 2. And this leads to what? Inhibition of protein synthesis, and thereby the cell death happens. Okay. So you can very well remember here that this particular one A, B, C, D, E, F. That's A is what? A is ADP ribosylation. These are components A and B. B helps in binding. A is ADP ribosylation of elongation factor 2, this EF, and this is for what? It is for CD. That is the Corynebacterium diphtheria. Fine. So remember this particular stuff also. And other than this, what you need to remember is you can remember this particular mnemonic for the various urease positive organisms. If you get always confused up that what are the various urease positive organisms. So remember in this, the staph club, the club is starting with C. Staph club may urease program hai. Okay, these are the various urease positive organisms. And what are those? They are staph club में urease program है. And can you tell me which particular colored media is urease media? It's a yellow colored media, and it changes to what? It changes to pink when some urease positive organisms is being put into this urease media. So remember, the urease media is which color? It is yellow color, and it changes to what? It changes to pink whenever these particular one they got to be in this. Fine. So what is there in this urease positive stuff? The staph is what? The staph stands for staph aureus. Okay. And this K is what? K is Klebsiella. K is what? K is Klebsiella. What is M? M is what? M is Morganella. What is M? M is Morganella. And U is what? U is Uroplasma urolyticum. Okay. This particular one is also urease positive. P is Proteus. And the question which can come to you is maximum urease positive is which one? The answer to this particular one is maximum urease positive is Helicobacter pylori. Okay, Helicobacter pylori. This particular one is the maximum urease producer. So remember, if you find difficulty in remembering urease positive organisms, these are important ones which I am telling you. Staph aureus is not as such urease positive important organism, but for the namesake you can remember Staph aureus is also urease positive. K is Klebsiella, M is Morganella, U is Uroplasma urolyticum, and P is Proteus, and H is Helicobacter pylori. Okay. So remember the various urease positive organisms by this. The staph club में urease program है. Fine. Then you remember another important mnemonic if you want to, that what are the various properties of these particular things, that is the endotoxin. Okay, you know endotoxin is secreted by what? Gram positive or gram negative? It is secreted by gram negative, that you know. Fine. So if you want to remember up by this particular name only the various features of this endotoxin, so how you remember that? This particular endotoxin, if we write up like this, okay, so that will give the most of the properties of this particular one. Okay, so it affects of the endothelial cells. Remember, it affects of the endothelial cells, and this is the causal agent of developing what? Edema there. Okay, so remember this particular one. Then you have, if you have ever have a confusion that this particular one is by which fellows? Gram negative ones. So negative bacterias, that is a gram negative one, they secrete up endotoxin. Okay, they secrete up endotoxin. So mostly gram negatives they secrete endotoxin. Can you tell me one fellow in the gram positive important one which secretes endotoxin? The answer to that is listeria. Okay, so remember that listeria is one of the fellow. Along with exo, that fellow also secretes a what? Endotoxin, even though that is a gram positive cocoa bacilli. Fine. So remember that particular one also. And this particular endotoxin action associates with what? DIC. And what is DIC? Disseminated intravascular coagulation. Okay. And obviously it can cause endotoxic shock and all and leads to death. Fine. Then it associates with what? Outer membrane. which is present in the gram negative ones, the outer membrane stuff. Okay, it associates with various factors of inflammation, that is tumor necrosis factor and all. Okay, you know that lipopolysaccharide O and all that protein. So that particular one, that is the O antigen, is involved in this. Remember this particular thing also. Okay, and X, you can remember up, extremely heat stable. This particular one is what? It is extremely heat stable. This particular one is extremely heat stable. Fine. And this I is what? That is the interleukin 1. This is involved. This is a cytokine which is involved in this. And there is a release of this particular stuff also, that is nitric oxide in this one. So by this endotoxin only, you can remember a lot of things, that it causes endothelial cell damage and leads to edema and all. Okay, negative, it is being secreted by negative, gram negative fellows mostly. Okay, D is it leads to DIC, even death can also happen. Association with outer membrane. Okay, T is tumor necrosis factor. O is O antigen associates with the lipid O, if you remember. Okay, X is extremely heat stable. I is interleukin 1, and N is nitric oxide. Okay, so they associate with this endotoxic action or endotoxin. Fine. So remember all these stuffs. Other than that, if you want to remember up more of them, then you remember something about the trichomoniasis. Okay, you remember something about the trichomoniasis. Okay, Trichomonas Vaginalis. Okay, in this you remember the 5 F's. Okay, and what is that 5F? It is flagellated. You know that it's flagellated. How many pairs of flagella? 5 pairs of flagella are there in this particular Trichomonas vaginalis. Remember one thing, that this is the Trichomonas vaginalis is the only protozoa which have only the cystic stage. Sorry, which does not have any cystic stage. It have a trophozoite one, and the trophozoite is having how many pairs of flagella? 5 pairs of flagella. Fine. So it have 5 pairs of flagella here, that you need to remember. And other than that, you need to remember it associates with frothy discharge. It associates with what? It associates with frothy discharge, and this discharge is what? Greenish frothy discharge, that you need to remember. Okay, associates with fishy odors sometimes, because fishy odor is there mostly in the bacterial vaginosis and all, but here also you can remember sometimes it associates with fishy odor also, right? Sometimes. Then this particular one is a fornication, and fornication, you know, is a sexually transmitted disease. So this particular trichomoniasis is a fornication, so that also need to remember, a sexually transmitted disease. Fine. And what is the drug of choice, which was the AIMS question? So remember for that the company name of the matrozil, that is a flagell. Flagell is the drug of choice for this particular one, and other name of this is metronidazole. Okay, the other name of this is metronidazole. So 5F are what? It is flagellated. How many pairs? 5 pairs of flagella, and this is the one which does not have any cystic stage. It have only the this particular trophozoite one. Frothy discharge is there in this, greenish frothy discharge. Okay, fishy odor is there in this particular one. Fornication, it is a sexually transmitted disease, because you have to treat both the partner and the fellow. Okay, so and drug of choice is metrozil. That is what is the drug of choice. That is the flagell for this. Fine. Other than that, if you want an extra point in this, you want that there is a particular thing here in the Trichomonas vaginalis, that is termed as what? That is termed as colpitis macularis. Okay, that is termed as what? Colpitis macularis. And colpitis macularis, another name is what? That is the strawberry vagina. Okay, so remember this particular thing also associates with trichomoniasis. Fine. So remember colpitis macularis, that is strawberry vagina, associates with this. Greenish frothy discharge is there, and the pH. The pH goes more than 4.5. Okay. Can you tell me a condition where else the pH goes more than 4.5? That is the bacterial vaginosis. Okay, if you remember. And what is the most common cause of bacterial vaginosis? That is the Gardnerella vaginalis. Fine. And that is a definite question in the exam. You need to remember that particular one. Okay, there is Gardnerella vaginalis, and what is there in that? There is a discharge in this, and when you put that discharge in 10% KOH, what happens? Fishy smell comes. pH there also is more than 4.5. And remember the important one, clue cells. Clue cells are there in the bacterial vaginosis. So remember that particular stuff. And what is the name of the criteria? That is the Amsel's criteria. Okay, and Nugent's criteria also associates with bacterial vaginosis. So remember, guys, definite question is there for bacterial vaginosis. The pH more than 4.5. Okay. Other than that, you need to remember regarding the discharge. Whitish color discharge comes, and when you put the 10% KOH, the fishy smell comes. Clue cells are there, and what is the clue cell? Epithelial cells. Okay, epithelial cells having this Gardnerella vaginalis means the gram negative ones. So obviously they will look like gram stain and all, like pinkish. Fine. So remember that particular one. That is the Amsel's criteria which is there, and another is also there, that is termed as Nugent's criteria, and they are termed as in this particular bacterial vaginosis. So remember that particular thing also. Fine. Then in the last, if you want, then I can tell you something about the Pseudomonas also. And in the Pseudomonas, you can remember by this mnemonic only regarding the Pseudomonas, that what are the various features of Pseudomonas. Okay, it leads to pulmonary infections. Everybody knows it associates with pulmonary infections. Those particular pulmonary infections like VAP and all, it associates with that. What is VAP? VAP is ventilator associated pneumonia. Okay, S is what? It associates with septicemia. Okay, Pseudomonas associates with septicemia. It associates with even with eye infection and all. Fine. It can cause eye infection and all. It can lead to even rarely endocarditis and all. Fine. Then you need to remember it associates with UTI, and that is also some minimal cause. Okay. D, that is the dermatological thing which associates with this manifestation, which is asked in one of the exams. That is the ecthyma gangrenosum. So remember this particular one also. It also associates with this. O is otitis media. This one associates with this. Okay. M is, it associates rarely with meningitis also. So remember this particular one also. Okay. O is just with the mnemonic stuff. N is, it leads to nail bed infections. It can cause nail bed infections also. Pseudomonas. Okay. And these particular one, that is the S. S associates with sepsis and all also. Okay. So this is also one of the, if you want to remember up that which all infections are being caused by Pseudomonas, so you can remember them by this particular mnemonic Pseudomonas. P is pulmonary infections, S is septicemia, E is eye infections, endocarditis, U is UTI, D is dermatological, that is the ecthyma gangrenosum, O is otitis media, M is meningitis, okay, N is nail bed infections, and S is sepsis. Okay, S is sepsis. So these are the infections of this particular one. That is the Pseudomonas one. And the question which can come up in the Pseudomonas is that Pseudomonas, what is the culture media? What is the best selective culture media for Pseudomonas? The answer is Citramide agar. Citramide agar is the best culture media. And remember, you need to remember which type of smell comes from the Pseudomonas. Remember, there is a fruity smell, grape-like odor. And what was the fishy smell? Fishy smell is Proteus. Okay, so these all things are there, and beyond this, if you want to remember up that Pseudomonas like associates with VAP. Okay, and it's the biggest enemy of what? Burn wound infections. It's the biggest enemy of what? Burn wound infections. Most of the burn patients, they die of Pseudomonas infections only. Okay, so remember this particular one also regarding Pseudomonas. That is associated with ventilator associated pneumonia and it associates with various burn wound infections. And regarding the anti-pseudomonal drugs and all, you remember vancomycin is not an anti-pseudomonal drug. So remember that particular one, which is a favorite question of examiner, and that full list of anti-pseudomonal drugs you need to remember. Okay. And what is Pseudomonas? Pseudomonas is a non-fermenter. Okay, it's a non-fermenter. It's a gram-negative bacteria. Fine. It's a gram-negative bacteria. Catalase and oxidase both positive. Catalase and oxidase both positive. And this is being asked that the dermatological manifestation is what? Ecthyma gangrenosum or ecthyma gangrenosum. Is it fine? So remember this much for today. And soon I will be making more of the mnemonics videos. Thank you so much.